How is the definition of death changing euthanasia debates? Imagine a world where the line between life and death isn't as clear as it once seemed. That's exactly what's happening today as our understanding of death evolves. Traditionally, death was marked by the stopping of the heart and lungs, but now, medical advances have shifted that view. Today, death is often defined by the permanent loss of brain function, including the brainstem, which controls vital processes like breathing and heartbeat. This change is mainly due to the use of ventilators and other life support systems that can keep the body alive even when the brain has irreversibly stopped working. This new way of defining death has a big impact on euthanasia debates. It raises questions about when a person is truly dead and when medical intervention can be ethically stopped. For example, if someone is brain dead, they show no signs of brain activity, but their heart might still beat with the help of machines. Many countries now legally recognize brain death as death, but some argue that this blurs the moral lines. Should we consider someone alive if their body is kept functioning artificially? Or is death only when the brain stops completely? Some experts suggest broadening the criteria even further to include partial brain death. This means declaring death even if some brain functions remains. That idea is controversial because it risks calling someone dead when they might still have some brain activity. This could lead to premature decisions to end life or withdraw care, especially in cases where patients might recover some functions or have a chance at life. From an ethical point of view, this shift challenges our respect for human life and raises concerns about vulnerable patients. If death is defined by brain function, then how do we protect those with severe neurological injuries from being declared dead too soon? There is also worry about organ donation, as the definition of death directly affects when organs can be ethically harvested. Practically, this change influences when doctors decide to stop life, sustaining treatments, or consider euthanasia. If death is based on brain function loss, then ending life before that point might be seen as morally wrong. But in cases of irreversible suffering or unconsciousness, some argue that ending life could be compassionate. The focus shifts from just biological activity to the quality and meaning of life itself. In the end, the way we define death continues to shape euthanasia debates. It influences moral judgments, legal standards, and medical practices. As science advances, these discussions become more complex, but they always revolve around respecting human dignity, protecting vulnerable people, and making ethical choices that align with societal values.